We're at the Ferezy Clinic in Windsor Heights again, and Dr. Joe and I are going to continue our discussion about headaches. We're going to talk about the different kinds of headaches and how to treat them. Dr. Joe, it seems like the term migraines is thrown out there constantly. Can you tell me a little bit about migraines? What is a migraine?
Absolutely, and that's so true. Many people think that they get a headache, it's a headache, but if it's really bad, it's a migraine.
Yes.
But that's not the case. Migraine is a completely separate clinical entity. In fact, it's not even just one clinical entity. Migraine is sort of an end stage, and there are a number of things that lead to migraine. So the classic migraine is a one-sided headache. In fact, the word migraine comes from the word hemicrania, which means half head.
Okay.
Patients that get true migraines typically have nausea, sometimes even vomiting with the headaches. They don't like light, they don't like sound, they just want to lie down in a quiet room. This is many times more, at least 2 or 3 times more prevalent in women than men, and there's a strong genetic influence. Typically an aunt or mother or grandmother has a history of these kinds of headaches as well.
Why are women more prone to this?
You know, nobody really knows. It's just a phenomenon. In fact, across the board, when it comes to headaches, women are more susceptible to them.
Great, we get it all, don't we? I tell you. Well, do you treat patients with migraines?
Yes, we do. And quite frankly, migraine is a very frustrating thing to treat.
Oh, I believe it.
Yeah, usually we'll co-manage this with their medical professionals because there's a classification of drug called the triptans, which really do help migraine sufferers. However, sometimes patients will get pregnant and they can't take medications, or they have other medical illnesses, or the triptans just aren't enough or aren't working, or the person just doesn't really want to continue to take medications. And then we have to work with the patients, and a lot of this has to do with perseverance. We'll try one thing. If that doesn't work, we'll try something else. Typically, the things that we look for are what is triggering your migraine. Now, for some people, a tension headache is what's triggering their migraine. So if we treat the tension headache, and we'll talk about those next, the migraines go away. But for other patients, there are cycles. Menstrual cycles, certainly one that a lot of women get menstrual-related migraines. But we also have something called circadian rhythms, which are daily cycles. And the amount of sleep you get, how long you're awake, stress that you're under, these can affect these circadian rhythms. We work with breathing and exercises, and then probably the most important thing is diet. And I'm not just saying to put the person on a diet, but we use something called an elimination diet.
Okay.
Chocolate, cheese,
oh
wine.
My gosh.
Everything
yeah,
that's
everything
good.
I like, yes.
That's exactly right. If it's good for you, it's bad for you. If it tastes good, it's bad for you, probably. But things like wine, cheese, chocolate contain substances that trigger migraines in patients. And there's a number of other things that do. So we try and eliminate the most common causes, and if that works, great. We can actually add things back in one at a time. But if it doesn't work, then we try other things as well. But as I said, it's really a matter of trial, error, and perseverance.
Dr. Joe, it sounds like migraines could be something that's very painful for people to have. I must admit, though, I'm not sure I'd be willing to give up chocolate. We'll just have to see. Thank you for giving us all the helpful hints about migraines and what causes them.
You're very welcome.
Stop in and see Dr. Joe, or for more information, give him a call or visit his website, ferezyclinic.com.